Hi, I'm Dr. Steve Petteruti. I'm a board-certified family doctor. I'm board-certified in medical weight loss, and I'm fellowship-trained in anti-aging medicine. I have a practice in Warwick, Rhode Island, accessible to anybody in the Northeast, called the Petteruti Center. The Petteruti Center is unique in that we have the ability to treat primary care, we have the ability to do medically significant weight loss, the anti-aging component, and just as importantly, we have an aesthetic component as well. As I like to say, you don't want to live to be 120 and look the part. There are things that can be done non-surgically, thoughtfully and safely that preserve the quality of your appearance as well as the vigor of your internal well-being. My ambition was always to go into family medicine. I always said that I like the patient more than I'm interested in the disease. So it led me to primary care. I knew that going in. After medical school, I was fortunate enough to have an Army scholarship. I went from Philadelphia into the military for 7 years, did my training at Martin Army Hospital, had some excellent primary care training, and started down my pathway of helping people one patient at a time. To me, anti-aging, functional medicine is applied great medicine. We're really interested in prevention in the most advanced sense of the word. Prevention doesn't mean finding a cancer lump. It means figuring out what things went into that condition, how did it get to that point, and stopping it before it begins. So that's breathtaking, a different paradigm. Even at the outset, before I knew of the Academy's existence, I was drawn to a preventative line of care. When I was in the Army, I was in charge of the overweight soldiers, called the Fat Boy program. They'd come to see me, I'd test their thyroid, and then we'd throw them out of the Army because they didn't lose weight. And I thought, this is ridiculous. There's gotta be something more going on here, something medical that is interfering with these dedicated and ambitious soldiers from their goal. And I started researching alternative approaches to care, and I came upon a method of treating weight loss that has had profound impact on many patients' lives. I'd say life-changing medicine. And I guess that was a step into a world of higher education for me, away from the things that I had learned traditionally. I began to realize that all knowledge isn't possessed within the box called traditional medicine, and that if I really wanted to help people, I needed to go outside of that box. The fellowship has been an absolute breathtaking enlightenment for me and for my staff. I got board certified, I'm going after the fellowship. My patients deserve that. We have developed the Petteruti method for weight reduction. I have come to appreciate that the metabolic syndrome, let's call this medically significant weight. Anybody who is overweight to a degree that impairs their health or their longevity. If you had to do one measurement to correlate with lifespan, cancer risk, heart risk, longevity, and well-being, it would be abdominal circumference. That's more important than blood pressure, than cholesterol, than any other measurement. So in the Army, where we have these highly driven, highly disciplined soldiers that could not achieve their required body weight, they were going to lose their career. Nobody could be more highly motivated than some of these soldiers, and yet they couldn't achieve it. They required a different approach, including thoughtful use of pharmacology and applied nutritional counseling. So we have had outcomes that parallel surgical outcomes with none of the morbidity. We've had a lot of experience now with bioidentical hormones, and we've come to appreciate that you have to have great partnerships. So we have been able to create great partnerships with compounding pharmacy so that our products we know are going to be pure, consistently manufactured, and our patients are going to get great service. And I'd say the Academy and the training that I've acquired has enabled me to go far beyond merely slapping testosterone on people and calling that anti-aging medicine. It starts prior to then on a cellular level. We have to look at what are the ingredients that go into youthfulness. What's the difference between a human being at 35 and at 75? And what can we do to change this progression in a more favorable manner? My knowledge about nutrition has expanded tenfold. The ability to scientifically and medically analyze based on clinical symptoms as well as through lab testing where the deficits are. I think the days of shotgun treating people with vitamins because they're good for you are over. Taking a Walmart super vitamin is yesterday's approach. Today's approach is making sure that what you take matches what you need in the proper amount and somehow gets absorbed adequately. One of the areas that I fully underappreciated was the immersion of toxins in our society and our world. They come from the water we drink, from the air we breathe, from the containers that house our food products. It can interfere with cellular function. It can interfere with intellectual function. It can increase the risk of dementing illness, memory erosion, Parkinson's, sexual dysfunction, and yet most doctors never test for it, and I certainly didn't. However, we now have the ability to analyze the toxic load in the body, and we now have the skills to detoxify the body, optimizing health over the span of a life that we're targeting to be 120 years. There's nothing wrong with getting old the old-fashioned way. It doesn't make you a bad person if you decide you want to go down the pathway that our forefathers have gone down for thousands of years. But today you have a choice. You can choose a different path, and that path requires optimum nutrition, optimum lifestyle, and optimum hormonal support. Probably the best way to learn more about me, my practice, and what we have to offer is to go to our website at thepetteruticenter.com.